For men, this can easily decrease your sex drive or difficulty in getting an erection. For women, it may cause infertility, irregular or no periods. You may be confused on how such drastic health conditions could happen in the first place. But this is all because of your body being high in prolactin. Although this condition is more associated with females, but why does it appear that you can have high prolactin levels even if you're not a woman and not breastfeeding? For this reason, let's try to understand what it feels like when you have high prolactin levels and how you can naturally lower it to avoid further complications such as osteoporosis. Prolactin is an essential hormone produced by the pituitary glands, and it is needed for the production of the mother's milk during pregnancy and after giving birth. Implied by its name pro, which means to produce, and lactin, which means milk, prolactin levels are significantly high during a pregnant woman's last trimester and the breastfeeding period. However, excessive prolactin may cause complications and other diseases if not regulated properly. So what exactly are the 5 ways to reduce prolactin levels naturally? Number 1. Eat a healthy diet. A healthy diet is always associated with a good well-being, so it becomes your first line of defense in fighting certain health conditions. If you want to lower your prolactin levels naturally, eat foods that are high in zinc. Some of these can include beef, turkey, and beans. Zinc helps in delaying the production of prolactin through dispersed pituitary cells. Some experts have linked zinc deficiency as one sign of having hyperprolactinemia, or the technical term for high prolactin levels in the blood. Pay attention to the common symptoms of hyperprolactinemia, which are irregular periods, decreased sex drive, and erectile dysfunction. Unusual symptoms that may occur include galactorrhea or milk discharge in non-lactating women, as well as gynecomastia, or the uncommon breast enlargement in men. So make sure that your diet is well balanced, as having normal levels of vitamin B6 and eating foods that are rich in this mineral, including spinach, potatoes, and bananas, may also reduce prolactin. Number 2. Exercise moderately. Depending on the cause of high prolactin levels, performing strenuous exercises or high-intensity training may elevate prolactin in your blood. To avoid this, try doing some light exercises like walking, running, or swimming that don't cause fatigue to your body. Physical stress caused by heavy exercise may also trigger high prolactin levels. If the symptoms that you feel are still manageable, following a healthy diet and light exercise may help prevent hyperprolactinemia. However, always consult your doctor if the symptoms need proper medication instead. A blood test will be performed on you to determine the levels of prolactin in your body. Number 3. Regulate your blood sugar. High blood sugar may also cause high prolactin levels due to glucose sensitivity. Besides eating foods high in zinc, it is also advisable to eat a low-carb diet and gluten-free foods. Cutting off some carbs in every meal may lead to low glucose levels, eventually lowering your blood sugar. Meanwhile, gluten is a type of protein that is difficult to digest and may cause high prolactin levels as well. Gluten is also known as a wheat protein because it is generally found in wheat products. For this reason, you should minimize the consumption of foods such as bread, cereals, pasta, beers, and crackers to avoid increased prolactin in your blood. Excluding beer and barley in your diet is advised by health professionals because they are both high in gluten, and this wheat protein may cause inflammation in your intestines. According to one study, drinking beer and other alcohol may increase prolactin levels by causing changes in dopamine levels in your hypothalamus. We know that avoiding carbs is very difficult, but there are various alternatives how you could trick your brain and avoid midnight snack craving by switching to a more protein and healthy fats-rich diet. If you feel that some of these tips are helpful, would you mind hitting that subscribe button so we know if you enjoyed our content so far? We hope that this edutainment video helped you learn something new. Number 4. Manage stress. Aside from physical stress caused by heavy exercise, mental stress may also contribute to the rise of prolactin levels. One study showed that women who had experienced childhood trauma were more prone to high prolactin levels when they grow older. When you feel stressed, your body tends to release high levels of the stress hormone called cortisol. For this reason, your body then tries to initiate other functions to counteract stress. Studies say that to gain homeostasis under stressful situations, your pituitary glands release more prolactin levels. You can avoid stress by doing activities that make you feel calm. You can do light and meditative exercises to release more endorphins, a hormone that makes you feel relaxed. You can also go out with your friends and do your hobbies together to make you feel at ease. Another way to manage stress is by getting adequate sleep. A good night's sleep causes the release of more sleep hormone called melatonin, and more melatonin means lower cortisol levels. Your cortisol tends to be lower at night and higher in the morning, so if you can devote more hours of sleep during the night, always do so. A disturbed circadian rhythm may also increase prolactin levels, so always try to sleep at the same time each night. And number 5, avoid undereating. Anorexia nervosa, also known as undereating or an eating disorder for self-starvation, also causes high prolactin levels due to an imbalance in your blood sugar levels and elevated cortisol. Although you need to refrain from consuming a high-carb diet, you should also avoid neglecting a balanced meal that includes enough carbohydrates, protein, vitamins, and minerals. The prescribed amount of calories for women is 1,400 to 1,600 calories per day, while for men it is 1,600 to 2,000 calories per day. However, both undereating and overeating can cause hyperprolactinemia, so you should always pay attention to the food that you eat and to the amount of it. Prolactin has different functions among men and women. For pregnant women, prolactin makes the breasts grow bigger, preparing them for lactation. Prolactin is also responsible for the production of milk among pregnant and nursing mothers. For single or non-pregnant women, prolactin regulates menstruation, and for men, prolactin plays a role in sperm production. Following these 5 natural ways to reduce prolactin levels can save you from costly medications in the future, and even worse, health complications. It seems pretty obvious that having a well-defined diet is extremely important. We also discussed briefly about cortisol, and that imbalanced levels may cause high prolactin levels. Perhaps consider continuing to watch about the ways on how to lower your cortisol levels naturally. We have prepared a few valuable tips on achieving it. Thank you for watching Natural Education, and see you on the next one.